I'm Anita Agarwal, Associate Professor of Retina and Vitreous and Uveitis at Vanderbilt Eye Institute. The book has about 5,500 color pictures. A lot of them are photographs of the eye and several of them are pathology. It's unusual to find a clinical book that has this much pathology in it. Don Gass was a pathologist himself and continued to find more pathological tissue to illustrate his clinical points, and I've tried to do that and add more pathology to diseases that are newer, that have been newly described. So I think this book is unique that it does not just have color photographs, and we've tried hard to make the pictures as large as possible and have the newer modalities such as OCT. But I would like to say that this book is a comprehensive and an exhaustive textbook of information that will lead a clinician to make a good diagnosis and manage the patient. It is not an exhaustive collection of clinical trials and results of surgical or other treatment trials. The idea of the book is for a clinician to make a good diagnosis and to understand why a certain disease looks a certain way and how it's different from something else that it closely resembles. The uniqueness about this book is in several places in the book we have citations of other conditions and page numbers and figure numbers. So the reader who's novice and doesn't know a lot about these diseases can go back and refer to those pictures and be able to compare and contrast the findings so they really have it in their mind as to why a certain disease is that disease and not something else. I think this book is useful for every ophthalmologist and definitely retina specialists, residents, fellows. The reason that it's useful is, when we get a patient, even if you're a comprehensive ophthalmologist, you may get a patient that has something unusual, and it leads to comprehensive ophthalmologists to be able to discern and realize if this patient needs an urgent referral, if this patient needs to go to a certain particular specialist. These are things that the comprehensive ophthalmologist can understand from the Don Gass's book. And the one thing that we've changed in this edition compared to the previous edition is we've put in an extended table of contents. That was the one criticism that I heard from a lot of my retina colleagues was they knew it was in the Gass Atlas, but they didn't know exactly where to find it. So for that, we've separated the chapters a little bit differently and have an extended table of contents, and each disease entity, whether it's small or big, is listed in that table of contents, and it's very easy to find it. So I think it's going to be very useful for a comprehensive ophthalmologist, certainly for the residents and fellows in retina, and for people practicing in retina, even the ones who've been in practice for several years. It's absolutely positive, and I think I had the best commissioning editor and the best copy editor in Russell Gavidy and Sharon Nash. They become my close friends over the last 3 years, and I could send them an email at any time, and I always get a cheerful email back, whether I was a little upset or worried about certain things. They'd always calm me down, and more than anything, they were prompt and accurate, and it was just a pleasure to work with them. And in addition to the two of them that I knew a lot over the last 3 years, I have to congratulate the illustrator who I never met and didn't really correspond, but did a fantastic job of converting all of Don Gass's hand-drawn diagrams into artwork, and I think it's fantastic, and I have not had much corrections to make. I think they just got the idea after the first couple of artworks that they produced, and they just took off, and everything was so good I didn't have to make any corrections except for changing certain colors for certain things. And in addition, I have to thank the design person. Though we did not want to make this book very colorful as far as the pages were concerned, we just wanted to discern chapters by little color borders on the top of the pages, and I asked them for pastel shades, and they picked such good colors that were just appropriate, and I was extremely pleased and happy with what they picked. And the elegant cover is just, it's something that's really elegant, and I have to thank him for that. Yes. Retina is an exciting specialty. It's been exciting since the first day I learned about it, and it continues to be exciting both medically and surgically. and we have newer surgical techniques, surgical instrumentation, newer diagnostic modalities, and it's really a great time to be a retina specialist.